Good morning. So the history of a CNA is that they started in World War I to help out with nurses, according to Top Nurse. Usually these were uneducated in any sort of medical training, and they were volunteer positions. However, in the Omnibus Act of 1987, according to the National Library of Medicine, Ronald Reagan signed in this law, which basically stated that you had to have a high school education, you had to pass a training program, and you had to sit in on a state exam and pass to get this certification to become a CNA. The scope of a CNA, according to the Illinois Department of Public Health, is basic nursing tasks. So you cannot, as a CNA, you cannot pass medication, you cannot inject or put in or take out any sort of medical device. Some of these can be expanded if you are trained by a nurse. My involvement is I've always wanted to be a nurse. Even as a small child, I really loved everything to do with the medical field. But I also cannot stand the thought of sitting at a desk all day long, which is why nursing is perfect for me. I feel like I never sit at a desk anymore, and I'm not even a nurse yet. So I have completed my training program when I was 16 with Methodist, and then I started working at Proctor Hospital directly after. It's been about 2 years since I started, and I've learned so much since then. As important as all of this seems, some people still decide to negatively stereotype CNAs. Stereotypes like, so you just wipe butts all day? That doesn't seem like a very hard job. I'm able to detect life-threatening signs and symptoms of an emergency situation. If something seems off, I am the first one to see it. According to a CNA on YouTube, as well as myself as well, it's very physically and mentally exhausting work. Not only am I lifting, feeding, bathing, toileting people for 12 hours a day, I also have to deal with the mental part of this job, which is the verbally and physically abusive patients, as well as end-of-life care, which is basically comforting a family and themselves about when they are close to death. It is a very traumatic thing to go through, not only for the family, but also for myself, especially because I am so young working in this field. Total cares, which is basically I am taking care of that person in entirety. There is nothing that they can do. They're basically in a vegetative state. So before you say all I do is wipe butts, please understand that I did not spend all of this time and money to get the certification for you to demean my title by saying all I can do is wipe a butt. Now that I've gotten that out of the way, let's go sit down so I can tell you more about myself. Another thing people say is that CNAs are not an important part of healthcare. Boy, well, let me tell you, you are completely wrong. According to the Qualitative Health Research, CNAs are the eyes, ears, and hearts of direct healthcare. And according to the National Library of Medicine, CNAs make up 90% of direct patient care. Sometimes nurses, as good as they are, they don't have time to be in a patient's room as much as we are. So, what would a world without CNAs look like? Patient care would be horrific. There would be not enough staff to properly care for these people on a basic human level. According to CNA Buzz, it's about a 1 to 1,000 doctor-patient ratio and about a 1 to 4 nurse ratio. So before you say that a CNA's job is gross, maybe you should think twice, because I promise when you are in a situation where you can't help yourself, you're going to regret the day that you said that to a CNA. This job really made me appreciate my life and count all of my blessings. You never realize how lucky you are to have people in your life that care about you until you walk into a patient's room who is on their deathbed and they have no one surrounding them. So they am. Okay, well, as I was saying, kind of just goes hand in hand with that medical alert. It shows me just how lucky I am to be in a place where I can take care of myself and I can take care of people around me. Throughout all of my experiences with codes and traumatic events I've seen at this hospital, I've realized that bad choices do have consequences, whether it be immediately or whether it be 50 years down the road. These experiences always change into standards for my own health. I really started to take initiative in advocating for my health and my family members' health. It's been an eye-opener, and I'd not change it for the world, even though I've seen some things that I wish I haven't. I love my job, I love what I do, so I will give this back to Lauren so I can go back to work because I am almost late for work, so I have to go.